Hello and welcome to CNN News 18 special broadcast. We'll not say Happy New Year or we'll not say good afternoon because really the afternoon and the New Year is not good for India as well as for Bengal because of COVID positive. Like today is Monday, last Monday, the numbers in Bengals were near about 450, and last 24 hours the number has crossed 6,000. We are joined today with us GM Infectious Disease Dr. Yogiraj Rai, the man who actually started handling the first case of COVID when during the first wave of COVID, when people used to get very scared. In one of the very important doctors of Bengal who is treating COVID from the front. Welcome, Dr. Yogiraj Rai, to our special broadcast. Doctor, Doctor, first question is obviously from in 1 week, 450 to 6,500. What led to this exponential growth of numbers?
It is probably two things hand in hand. One is irresponsible citizens of Bengal uh, moving during this uh, pre uh, vacation and vacation time or winter vacation time with say New Year time, and along with that, a new kind of probable new kind of variant of COVID-19 available in and around West Bengal. Probably that could be Omicron, that could be something else other than Omicron, some new variant that goes rampage along with people's wrong attitude.
So both Delta and Omicron is, vice versa, working it out, storming it out. Is that so?
um, that is being put down here, but we are not doing enough testing of sequencing because we don't have that kind of support here everywhere in India. So you cannot say that it is only due to uh, past Delta, because if you see at Durga Puja time, there are people not being irresponsible. We have seen that pictures, but the surge was not there. Means
Yes.
Delta was, it is what Delta was there and it is not surge. Why Delta in this time has surged? So it could be a new strain or new variant, I would rather say, and that is causing havoc, and that will be identified soon, probably.
See, strong restrictions have been imposed from today in Bengal. Where do you see the situation going from here? And what is actually the situation in hospital where you are handling cases every day?
Actually, see the number of cases surges. The surge has been seen for last 5 days, and
Hmm.
if we look back to the prior experience of COVID, the number of cases increased doesn't mean is equivalent to number of oxygen requiring patients. It will take
Hmm.
another 7 days to 10 days to say that whether uh, this situation of surge is related to the oxygen requirement or not. If it is not, then it's fine. But if it is oxygen requiring patients are increased and the beds are full, then it will be havoc. So that's why
As a
restrictions are necessary.
as a citizen right now, what should we do? What is your message for the common man, who everybody is getting affected, symptomatic cases are rising? What is your message for the common man right now?
There are two aspects. One is preventive aspect, another one is treatment aspect. For treatment aspect, I would say whenever you have symptoms of COVID, you know very well what are the symptoms of COVID for past 1.5 years or 2 years, I say. So you know what is COVID, and if probably you had also COVID, then if you have this symptom, please restrict yourself and test. Uh, Test, because testing makes you restriction, so that is important. And for preventive aspect, uh, and check blood oxygen parameter, that is by saturation point of view. Twice a daily saturation you have to check. If it is below 95 or 93, you come to a oxygen giving facility like hospital. And the for preventive aspect, I would say you just ask yourself two questions while you are going outside from home. Is there is necessity to going outside this time? Then if it is yes, then only you go. If it is no, you stay at home. And if it is necessary, then you go outside. But you ask another question to yourself whether I am carrying a proper mask and fitting that in my nose and mouth cavities. So these two questions you must ask yourself while coming out from home.
Another feature is that mask has also become a fashion. So right now, the situation here in Bengal, numbers are rising. So is it, the common mask or the N95 or the surgical mask, which is the right type of
The
mask in all over India?
surgical triple layer mask or N95 mask, these are important, and this can prevent you from getting COVID, none other than else anything.
Doctor, another feature of this wave is that health workers and doctors. Right now, we are getting an information that in NRS hospital called Kolkata, 70 health workers, including doctors, nurses, they have been infected. Dental colleges, more than 35 doctors have been infected. Apollo hospitals, more than 10 doctors have been infected. So why is this? We have seen first two waves, there were health workers were infected, but this time it's high. What is the reason, and how will this situation be handled?
This is a very tricky situation, but then we have to follow, probably follow the CDC guideline or outside India guidelines, whether we have to change the duration of isolation from 17 days to reduce it to somewhere 7 to 10. That's up to the health administrator is required. And this is the situation where the hospital running will be very difficult. If all of us are affected, then who will run this hospital?
But then why is this that more of health workers and doctors in this third wave are getting infected, like
No,
first waves of?
they are affected in second wave also. Lots of us. But uh, if it is more infectious than second wave, then definitely the number will be more.
So that is one thing, that the infectivity rate this time is higher in comparison to what it was in the second wave. Is that the
Definitely,
thing?
definitely. Yeah, definitely.
So again, I'm asking, there was a network problem. That do you think that this wave, the infectivity rate, is much higher in comparison to the
Yeah,
other one?
infectivity rate is higher than previous episodes. It's definite because we are getting lot of infection in early phase amongst the healthcare givers. That was not there in early phase. That was present after 15 days of wave or 20 days of wave. It is now only 3 or 5 days of wave. You are getting this hell lot of doctors affected, and who will run this hospital right now? It's difficult.
That's really a big question, and this is the big question which has to be handled by the administration, that who is going to run the hospitals, because right now in last 5 days more than 200 health workers are infected. And as what Dr. Yogiraj Rai pointed out, that who will run the hospitals, may everything fall in place as doctors said. Once again we'll ask that what is your message for the people. People are also getting panicked, so there's nothing to get panicked. If you could say the last word, last message to our audience, and then we'll wind this up, because you also have a very busy schedule.
It is better to get some panic, stay at home, observe for at least 1 month what the situation is going where. If there is requirement of oxygen very high, then you have to follow the restriction. But but if the oxygen requirement is not that much high as second wave or first wave, then it's okay. So before getting into worse situation, better to be safe for last next 15 days to 20 days. I think restriction is required for next 20 days like that.
So, and thanks a lot, Dr. Yogiraj Rai. This is, this 20 days is very important, as what doctor has pointed out. All the people from Bengal, as well as from the nation who are watching, this 20 days is very vital. So, stay at home only if you are required, then only if it's necessity, then go out and venture out. And if you are venturing out, please wear N95 or surgical mask. Thanks, Dr. Yogiraj Rai, for joining us in our special broadcast.